So we're back at the Ritz-Carlton in Orlando. We're very happy to be here. It's Florida, the sun is shining today, and I'm here with one of my friends, Jerome Rerucha. Very nice to see you again.
Thanks for having me.
Yeah.
It is great getting you here in the United States.
Yeah, and this is a guy that you really should listen to. This is a Cairo, and you have done some really big achievements in your life. Please tell us about it.
Yeah, I started out as a full-time strength coach, and I was a competitive lifter. So powerlifting specifically is where I competed. Started at the beginning, ended up winning one world title. Through that, helped teach me a lot about neuromechanobiology as a strength coach. And then I left to become a chiropractor. I had a lot of great experiences as a patient and a lot of help from a very advanced chiropractor that helped me with my lifting and performance. And I took that with me into clinical applications. So currently I've done a lot of seminars for the last 20 years. So about 35 seminars a year the last 25 years to clinicians, and being able to integrate those two worlds. So really bringing cutting edge techniques and applications to the sport performance model, but also how it applies to the clinical model of the general public. And one of the things I lecture a lot on is low-level laser therapy, which you yourself are an expert on. And that's how Christian and I met in terms of helping each other with educating people on the benefits of true low-level laser therapy.
Yeah. And we're here at the Erconia convention, and you've given some really good speeches. You're one of the keynote speakers here during this weekend. And can you tell me a little bit about, for the audience, what you've been talking about during your performance?
So Erconia's been in the market for right at 23 years, and during this time there is very little research on true low-level lasers, and as soon as they got into the market we started doing a lot of seminars, a lot of education, but validating the science of low-level lasers, especially how different it is compared to other light therapy units such as infrared therapy, light-emitting diodes. So there's the whole just basic science of understanding how much more efficient low-level lasers are. And then just physics 101, shorter wavelengths have more energy per photon. And so the science has been proven of how a photon has to bind to a photon receptor for photobiology. Now, photothermal is very inefficient at that. So when you use higher powered products and you get heat, heat has therapeutic benefits when used appropriately. Conduction and convection methods are much cheaper modalities to create heat, but heat is always a sign of inefficiency, whether it's race cars, motorcycles, sending a rocket, and same thing in therapy. So heat is generated by inefficiency, and it's the photons not binding to transfer that information into the cell, into the mitochondria to make ATP. So it is a fact when using low-level laser therapy, there is no heat that is created to the tissues because the photons are being absorbed into the cell and creating ATP energy to help tissue regeneration, healing, and then there's even other cascade health benefits besides that.
If you look at the kind of athletes that you are working with today, what kind of difference would you expect to see when you add the laser treatment to their performance?
So as a strength coach and now as a clinician, as a strength coach, your job is to prevent injuries and improve performance. So when you look at any sport, sports can be unique, but you're predisposed to certain injuries. So tennis, of course, is tennis elbow, maybe some shoulder issues. You're still susceptible to foot and knee issues. Any soccer sport, rugby, I mean, sprained ankles is going to be way up there as one of the primary injuries. So in all cases, low-level lasers can help recovery. Really important. Before you have an injury, understand what is your biggest predisposition to injury, how does your training fatigue the body, and the recovery using low-level laser therapy is very profound. Outside of that, injuries can happen. We want to minimize those. And it is just a fact with research in terms of just doing therapeutic dose lasers, the effectiveness that it does for increasing tissue regeneration. And it'd be very conservative to say, and PubMed would validate this, that just using low-level lasers on any tissue, tissues regenerate at different rates. but any tissue would regenerate approximately 30% faster just from using low-level laser therapy on them.
Yeah.
And then when combined with the skills of a clinician, if you do soft tissue work, obviously that works by itself,
Yeah.
adjustments, rehabilitation, you're going to add to those benefits.
Yeah.
But that mitochondrial benefit, that is just a scientific fact of how low-level lasers work, is very unique, and it does it more efficiently than any other modality on the planet.
Yeah. So if you turn away from the rehab side and go to the performance side, if we just switch the focus
Sure.
a little bit,
Yes. Yep.
how much better would an athlete get?
Oh man, you're looking with healthy people. I mean, every percent means everything to an athlete.
Yeah.
So you might not take somebody who benches 300 pounds and make them bench 390 pounds. We're not saying that's how it happens. But to help you prevent injuries and recover faster, which is a huge part of it, it will do that. Now with sports, especially open skilled sports, you can train the brain. Like there's so much research happening right now with sick, injured people,
And
for autism, learning
you can actually use the laser on the brain?
Oh yeah. So I have a brain EEG in my clinic, and we don't just do the clinical things that are very validated. There's some just amazing studies going to be coming out from Arconia as well. Some of it's proprietary right now, but I'm a very proactive person. So that being said, we do a lot of training, and as you drive pathways, whether you laser during you're driving a pathway or you do certain sets, and then in between you laser the brain. When you activate brain pathways and you use the laser, it takes that energy, even unique to just the clinical values of it, of how it drives and verifies cellular communication, neurological communication. So literally, if you shoot free throws and laser in between free throws, you will drive the pathways that are necessary to be a very successful person shooting free throws. Now this goes way beyond, like throwing baseballs, any sports skill. We've done this with fighters. Douglas Lima last night won his third world championship at 170. He's been a client of ours ever since he's 18. So we've done a lot of unique things with him. As far as, you get bumps and bruises in mixed martial arts, but that's not our primary thing. We do a lot of proactive things, and it's no coincidence he's been as successful as he has. He's a fantastic fighter without us, but we're looking for every advantage and that neurological gain, that speed, effectiveness. There's a lot of talk out there on concussions and traumatic brain injuries, and we don't motivate anybody by fear, but when we do EEGs of Douglas's brain, even being an MMA fighter for 15 years now, he's got one of the best brain EEG scans in our office. I mean, it's just fantastic, and it's that recovery that we promote using the low-level laser in terms of how we're able to get those types of scientific results.
Yeah. And this is actually fantastic things that we see from your office all the time, and that you're sharing with us.
Yeah,
So,
and we use it on a wide variety. So recently, we take very regular clients, and then if they're interested, we do introduce them to competitive sports of any kind. So recently, we also had Gail Williams, she suffered from chronic pain her whole life. At age 69, she came to our office, and we got her pain-free in a short time. Lasers is a huge part of that, understanding the weak links that were sometimes missed, or even if they were recognized, they didn't have laser therapy to help her regenerate. Since then, Gail owns all the state records in Georgia. She's now 71, but she's so strong at 71. She owns all the state records from age 55 to age 75. And she won a world title in Tokyo this last year. And so those are things that can really measure even above and beyond scientific. You have an injury, now you're asymptomatic. We go way beyond symptoms with our protocols, and laser's a big part of that, to where it starts going into sport performance, and we compete against the world. It's not our rules, it's not our saying. I mean, these are very particular rules, and we have to compete against everybody else out there. So every age group, we're doing youth sports, but competing in all sorts of different venues. It's a big advantage for us.
And what we see is what you're talking about here with the performance about with the humans. We see the same thing in animals.
Yes.
So where do you think the laser and the science that we are working with are in 5 or 10 years?
Yeah, so light therapy started in Europe, even though this is different to the original thought process, where they were using very long wavelengths, and there's a belief that longer wavelengths penetrate deeper and more power works better. And that has, in modern day research, even in comparison studies, that is absolutely, the concept has been improved upon. Let's just say that. And very simply, the battery power does not affect the energy of a photon.
Yeah.
So phototherapy is 100% dependent on absorption. It's not depth of penetration. The cell has to absorb the photon. That energy is transferred.
Yeah.
And
it has to work with the body.
Yeah.
It's not
we're not trying to stimulate, we're not trying to suppress, we're trying to facilitate optimization. And you could put a liquid nitrogen cooled Hemi on a light therapy product. It does not affect the energy of a photon at all.
Yeah.
None. That is 100% dependent on the wavelength. So the wavelengths that Erconia use are very significant biomodulators. At 635 nanometers and at 405 nanometers, they're much shorter than many other products on the market, and just that alone, the advantage of energy transfer into the body is exponential. When you look at the physics of Hertz, and shorter wavelengths literally have 1,000,000 to quadrillion times more energy. When you look at a 405 nanometer on physics with Hertz compared to an infrared, it has a quadrillion times more energy in Hertz.
And this is really interesting because we hear a lot about the 405. There were an FDA 510K clearance just recently. And we see from other companies in the world that the 405 is it doesn't penetrate enough. So what is your stake on this one?
Well, it is true that shorter wavelengths do not penetrate as deep as longer wavelengths, but again, it's all about depth or it's all about absorption. Now, there's a lot more that happens with depth of penetration. Now, one reason why certain wavelengths penetrate deeper is they're not being absorbed. Okay, I can shoot you with an arrow. Okay, I can shoot an arrow all the way through you. That's not exactly healing you. Okay, so absolutely, these wavelengths that penetrate deeper, if many of these cells, they need photonic energy and ATP, it's just not being absorbed. Okay, now that being said, when people think low powered, like 7.5 milliwatts or even shorter wavelengths don't penetrate, it's like that is old science. And we have fMRIs going through the skull with a single 2-minute laser treatment that shows changes on fMRI all the way to the pituitary from doing a single 2-minute dose in an area. And when the photons hit the body, it's kind of like food coloring in water. I get what you call the physiological cloud. And this is not guesswork. We've proven this on fMRIs already. That will be released. It's kind of proprietary slides and pictures, but it is currently going through the process right now. And people are just going to be, really blown away of a little bit of the misinformation from old science compared to what is validated with the latest and greatest technologies out there of what's happening.
So we are really looking forward for a kind of a new kind of medication. Is that what we are seeing here?
Well, as far as it's a substitute, can't say that legally in certain instances. The thing is, we always want to make, if medication is necessary, which it is, when used appropriately, surgery and medicine is necessary. The lasers alone has been proven to greatly increase the healing response if surgery is necessary. The effectiveness is amazing. The decrease in infections. And then there's a lot of conditions out there that medication is not helping. As far as the neurodegenerative conditions out there, when you start looking at the antibiotic problem that's out there, and it's just a fact. And again, 405 has gotten a lot of unique attention in PubMed due to the antimicrobial benefits, but you still get all the ATP benefits. And because it's so unique with the antimicrobial benefits, so when using the red laser, The ATP goes into the nervous system in every cell in the body,
Yeah.
but it goes into the cells of the body, goes into the nervous system. The nervous system helps the immune system work better.
Yeah.
Okay. It is a fact when using a 405, you don't need the body. And like you laser things in a petri dish, the red will not kill certain infections by itself. It needs the body and the
Yeah.
efficiency of the improvement to the body. 405 will kill infections without the body.
Pretty fantastic.
And it is. It's amazing. And that's validated by PubMed. So
Yeah.
that's not just a single company making those things up. And that's why when you go into PubMed and you research articles on 405, they don't talk about the neuromusculoskeletal benefits, the acute and chronic pain regeneration with ATP synthesis as much. It's so unique. The immunological value, that's where it gets a lot of attention. But Erconia did just complete a level 1A study showing the benefits of chronic neck and shoulder pain using the 405 nanometer to validate its, we're very proud of the multiple FDA clearances Erconia has on the immunological side and proved that fact, which PubMed validates. But also don't forget the mitochondrial benefits you still get with the 405 as well.
Yeah.
And that goes for animals. So we kind of started talking about that. And here again, when you start applying lasers in a competitive setting, you really are measuring under standard of care. So lasers are very commonly used with race horses, agility races with animals, in the dog sporting world.
Yeah.
I mean, they're huge, and owners and trainers, I mean, it's just so finite how they train the animals, and they can see these deficiencies, and whether you're lasering the area of involvement, such as if there's an injury to the shoulder or the paw of the animal, but to really integrate treating the nerves that go to the paw or the leg. And once again, even in the case of lasering cerebellums and cortexes for the motor feedback loop, it's very safe doing it with low-level laser therapy, very effective. You would never, ever laser a vital organ, laser the brain, or laser a nerve root with a high-powered laser. That would make absolutely no sense.
Yeah, you don't want to fry the brain.
No, and even if we're not going to go to extremes like you're going to fry the brain or burn it, it's like that is inefficiency.
Yeah.
These are neurons. They're sensitive, and it's just very contraindicated to do those things. And low-level laser therapy is so safe and so effective, and research is proving that more and more.
And there are research on using the lasers on the brain.
Yes.
Yeah.
Yeah. It's. I mean, even without Erconia's involvement, it's a known fact. Light therapy with stroke has been in PubMed for a while.
And TBI.
People. Traumatic brain injuries, concussions now, neurodegenerative. I mean, medication is doing zero benefit for the neurodegenerative conditions, and it was just said in science for years up until recently. You can't unfry an egg.
Yeah.
And that's the analogy they're making to the brain. Now, what they're finding with low-level laser therapy is, I mean, this is a chronic neurodegenerative condition that has taken years and even decades to get to the point that you have the symptoms of a neurodegenerative condition. But there is proof and validation, not with just 1 or 2 laser treatments, but we're not talking years of laser therapy to see change either, where they're actually seeing a reversal of the neurodegeneration.
Yeah.
Now, there can be limitations of matters, but again, doing the seminars that you saw us here, lasers work all by themselves, point and shoot. Erconia currently has 17 level 1A FDA clearances.
Yeah.
And what that means is the clinical skill of a practitioner is not allowed in the study.
Yeah.
Okay, so nobody knows who got the real laser, who got the sham laser. It is literally random site, double blind.
Yeah.
And just hitting the start button, you're not allowed to influence.
Yeah.
You're not allowed to do rehab, soft tissue, give nutrition, tell them to drink water, quit eating 12 Pop-Tarts a day. You're not allowed to do any of that. And nobody knows who got the real laser and sham laser.
Yeah. Well, do you know what the sham laser is?
The sham laser in the study is actually an LED.
Yeah.
Okay, so even though it is considered the placebo, LEDs do have some benefit.
Yeah.
Very minimal compared to a true laser, but just so you get the visual effect. And so truthfully, the studies are true laser versus LED.
Yeah.
And PubMed knows the difference between the two, but many doctors don't. So there's multiple values of education to clinicians to really help them understand what you can bring into your office and the effectiveness and safety of this.
Great. And we're very happy to have you here.
Oh, it's great.
It's so great to see you.
All right. All right, thanks
Yeah.
for all the hard work you're doing as well.
Yeah,
and it's just
same.
great working together
Yeah.
to educate everybody out there and the benefits of low-level laser therapy.
Yeah, and we're hoping to see you in Europe
We will. We're
in
coming.
a while. Yeah,
Yes,
definitely.
Definitely.
Thank you so much.
My pleasure.
Yeah, thanks.